It's the last session today, so we're on webinar 4, and that's all about making it happen. So the next steps throughout the series, sort of throughout the session today, we've got an hour. If you would be able to scan this QR code, and Mal will share that link in the chat in just a moment. Essentially, this is what we're looking to sort of complete today. So this is your call to action. I don't necessarily like that phrase. Essentially, we just want to sort of encourage you to look at, sort of think about what you've learned over the series, and obviously that will include today too. And then apply it by making one meaningful change in your workplace. So thinking about what you've learned over the past sort of 3-4 weeks, what has that sort of ignited in you to go back into your workspaces and change and move forward? And I think I've said this throughout the whole session, but you know, we're not looking for massive mountain moving action here. We're just looking for something that is manageable, that we're all able to do to go back into our workplace to actually achieve change. And the idea is that if we all, each of us, go back and do that, then we can make that culture shift that we're after. So within the form, it's just asking you that basically, and asking sort of how we can support you in achieving this. So this is sort of meant to be sort of a sustainable project whereby we, you know, keep in contact and keep those conversations going. And there will be, we'll touch on this later on in the session, but there are ways in which we can do that. But for now, anybody who joins, if you're able just to, whilst we're talking, whilst we're chatting, and whilst we're doing the activities, if you wouldn't mind just using the QR code or the link that Molly sent, just to see, just to say what you guys would want to go back into your workplaces and move forward, considering everything that you've learned. Mal, do you want to move on to the next slide? It's weird being on this side of the screen and asking people to move on to the next slide. I completely feel the pain, Mal. So today's speakers then, we have Amy with us, and we met Amy in the first webinar series. So Amy's back with us today. We're very lucky. And then obviously we have you guys, all the experts in the room. So this session, we set it up as a webinar series, as we already know, which hasn't allowed much of that interaction. And to be completely honest with you, that's the opposite thing of what I would normally do. But because we tried to capture so much information in 1 hour, we have had to mute the mics and everything else. So this series is the time where you guys are able to, you know, speak to one another, introduce yourselves. So we'll get to that a little bit later on. We have Fran with us today talking about the hive, and we have the lovely Catherine Aubrey, who's going to finish the session today, and it's going to finish on a bang, let me tell you. I also want to just at the minute, because if I forget later, and I'm likely to, just a huge thank you to the team, and a huge thank you to Amanda and Lottie for sort of facilitating today's session and helping out. Very, very much appreciated. So thank you. So without further ado then, if we go to the next slide, Amy, I believe this is you, so the floor is yours.
Thanks so much, Kim. Firstly, I am going to apologise if either of my dogs join in, if you can see them in the background. I promise they usually sleep through things, but if they do start barking, I can only apologise to start with. So hi, I'm Amy Loxley. I'm the Innovation Hub Director for West Yorkshire, and I have the joy of sitting across both the Health Innovation Yorkshire and Humber Network and the West Yorkshire ICB. Today, however, I am very much speaking in my health innovation capacity, and we are going to quickly go over our Why Health for Growth white paper that was recently published, which was around how we can reduce health inequalities and some of the key recommendations for national, regional and local level people across our systems. So next slide, please, Miles. So Why Health for Growth has been a long journey. So this started back in 2019, and it actually started around a growth conference, and this was very much looking at how does health in the economy massively impact one another. So we know that poor health often leads to a lower amount of economic growth in a region. So we are looking at how can we be more inclusive in our growth, how can we ensure that people from all walks of life, from all types of health backgrounds, are able to contribute to the economy, which ultimately then helps to build a cyclical economy of good health, good education, good money coming into our systems. Then we hit very badly in 2020 by the pandemic, and obviously a lot of people on this call will still be bearing the scars of that pandemic, not just people working within the NHS and within the health system when COVID hit, but also our communities that face some real challenges during the COVID pandemic. So after the first big two initial waves of the COVID pandemic, we were invited to create a paper called the Levelling Up Yorkshire and Humber paper, which was looking at the disproportionate impact that COVID had on communities up in the northern parts of the country, how we sustained longer lockdowns and some of the reasons behind that, and how we were more economically affected by that. Our chief exec, Richard Stubb, was asked to, whose face is on here, was asked to go and present at the Houses of Parliament and the Houses of Lords to talk about that levelling up and what that means for our public services, and how the work that we did in looking at the levelling up agenda impacted on that piece of work that the government ended up doing as well. And then finally in 2024 we did a stock take 5 years after our initial growth conference to understand where are we, have we seen improvements, and if we haven't, why not? So next slide please, Molly. Unfortunately, we didn't see an improvement. If anything, things got slightly worse, which was not what we had hoped for, but something that we are not surprised at. So to give you a bit of an understanding of where kind of health inequalities really make a big impact, is it costs the UK around £180 billion a year in ill health. So, and I am someone who doesn't overly like this phrase, but health related economic inactivity, it sounds very much like a buzzword, and it doesn't really sound like much. But what we're ultimately saying when we're talking about economic inactivity is people who are unable to work because of ill health, or people who are unable to spend money in our economy because they are unwell. Now, as someone myself who has a long-term condition that impacts my ability to work sometimes, I find it a little bit jarring to hear that I can sometimes be economically inactive when I'm unwell, because we forget that actually at the end of this, there's a person who's unwell and who has a health related condition. And I can very much speak from experience that I hate not being able to work. So when that is taken away from you, it is really challenging. But it's also challenging to our economy, and obviously our economy is something that helps to provide our schools, our hospitals. So it's really important, and they're all very much interlinked. Now, up in the north, we see almost 10% of that income and that inactivity actually sits across the northern regions. And that's not just Yorkshire and Humber, I will say. That is North East, North Cumbria, Greater Manchester, the Northwest Coast, and Yorkshire and Humber. So it's not just Yorkshire that's sitting there, but you can see the impact that the north-south divide has in terms of the bigger impact of health inequalities when it comes to our economy. But we do also have the third lowest life expectancy in Yorkshire and Humber. Now, this can be for multiple reasons. So, you know, we have widening health inequalities, we have less money coming into our economies. We do know that there is that health and wealth divide between the north and the south, but we've also got to think about what else contributes to low life expectancy. So we're thinking about, have we got green spaces? Do we have good access to education? Do we have higher level of pollutions? All of these impact, but often are driven through where the economy comes in. So next slide, please, Miles. So as part of our work in the Why Health for Growth, we made 4 key areas of recommendation. And for us, and I think this is probably, with all of my colleagues who are presenting today, this is probably the most important one, is that this has to remain people focused, because at the end of the day, we are talking about people, their health, their ability to work and live and provide and not live in poverty. We know how much poverty impacts on families, and we know that that can lead to generational poverty as well. So this is really important, that we ensure that people are at the heart of making those policy decisions, so that a policy is not done to people, it's done with people. Mol, sorry, just gone back to the last slide. Could I just go back to the other one?
Sorry, my laptop keeps falling off. I do apologise.
Thank you.
Sorry, I'm here, yeah. Sorry,
problem.
that's
No,
why
you're
my
fine,
camera's
don't
turned
worry.
off. I don't know why he keeps doing it.
You're absolutely fine. So as part of this, we need to really take a place-based approach. And when we talk about place-based approach, we need to think about our local communities. So do we have good access to schools, hospitals, GP surgeries, pharmacies? Do we have access to green space? But also, do we have transport? Do we have affordable transport? Do we have good, well-paying jobs in those areas? So we really need to look at our local microeconomies to actually understand the impact this is having on people's lives. But ultimately, we have to do this in partnership. So this is not something that the health service can fix or the central government can fix. This needs to be done in collaboration with multiple people across our region. So we need to think about what is the place for central government, what's the place for our local government, what's the place for our schools, our police, our housing. All of this impacts on our health and well-being. And health, when you actually look at social determinants of someone's healthy life, their actual physical health is a really small percentage of that. I think it's around 20% of someone's overall health and well-being. Only 20% of that is down to their actual physical health. So all of the factors that kind of come to making those sit outside of what the NHS can offer. So how do we do some of this in partnership with colleagues across an integrated care system across a region? That's why in West Yorkshire specifically, we are one of the very few ICBs that have an integrated care partnership where our combined authority mayor Tracy Brabin actually sits on our partnership board, because we understand the key relationship between our health system and our combined authority. And we have multiple roles that sit across that jointly. So it's a really strong partnership for us. But we also need to make sure that everything that we do is purpose-led. So we have to have a single shared purpose around that partnership working. And this is ensuring that people have better health, better economic prosperity, because ultimately they go hand in hand with each other. So next slide, please, Moles, hopefully. Perfect. So we created 10 recommendations from the white paper, and we will happily send a copy of the white paper out to you, and you will obviously get a copy of these slides. And I'm not going to go through each of these verbatim, because no one needs on a Thursday afternoon at lunchtime someone sitting and reading a PowerPoint presentation to them. But to give you an understanding, we split these out into a national level government perspective and what our recommendations are to central government, one to our regional level mayoral combined authorities, etc., and then looking at actually what are the businesses that need it, what's the business piece around this as well. So those 10 recommendations are there to inspire future action. They're there to make sure that we're building on the positive progress to date. So we have seen that the COVID pandemic actually really highlighted these on a national platform. People really understood the difference between the North and the South, and where health inequalities are really baked in systems. But we need to not let that energy wane. So how can we make sure it's still number one on people's priorities and agenda? We need to make sure that we can empower our local leaders, and that's not just our mayoral combined authorities, our local government in place, but we've also got to think about our health leaders, about how do we do some meaningful investment and power sharing to ensure that local places are doing the right thing for the people that they're trying to serve. Now, one of the things that we fundamentally believe in West Yorkshire is the principle of subsidiarity, which, if you've never heard before, again, I don't blame you. It's something that has taken me a while to get my head around, but that's about making a decision as close to the person as possible. So a decision that is going to impact on a person needs to be done as close to that person as possible, so it's the right thing for them. So ultimately, that subsidiarity piece is really, really important. But we also need to make sure that we're having investment and infrastructure there to support that to happen. So as you can see on this, we need to think about our workforce plan. We know that we still have huge waiting lists and elective backlogs, but we need a workforce plan where we're supporting our services to do this, and making bigger strides in investing in health innovation and research and developing that within our region, providing those high level jobs and opportunities for people sitting in our region to stay within our region. Next slide, please, Mol. Thank you. So at a regional level, we are incredibly lucky that we, especially in West Yorkshire, very much so in South Yorkshire as well, that we have combined authorities that absolutely see health as a fundamental part of how we need to do business, how we need to make sure that the health and wealth of our region ultimately impacts on our economy. So we need to make sure that when we're developing our purpose and we're developing that shared vision of how our regions need to grow in the face of the inequalities that we face, that health and economy need to go hand in hand and they need to be done in partnership. We need to make sure that NHS leaders maximise on the opportunities of our integrated care systems. We are still very new. We only became a statutory body last year. I should know this, shouldn't I? Oh my goodness. We'll go with last year. I could be wrong. It feels like a whirlwind. We've gone through so much in a couple of years. But we need to galvanise on the development of those integrated care systems and making sure that our fourth purpose, which again probably doesn't make a huge amount of sense if you're not sure what an integrated care system and how they work, but we have a fourth responsibility as an integrated care system around having that broader social and economic development. So again, understanding that they need to go hand in hand with one another. And then we're coming up to the last slide, so you will have the end of my voice very soon. But we also know that some of this action needs to be done by our local businesses. So how do we ensure that businesses understand that the health and well-being of their employees need to be fundamentally part of how they work? So how do we ensure that if you do have, for example, like me, a long-term condition that can mean I'm in and out of work on a regular basis, how do we support people to be the best that they can be at work and want to come back and feel supported? I'm extraordinarily lucky that my employer is very understanding and makes sure that they put enough safeguards around me so that I can continue doing the job that I love whilst also putting my health first. And that's a fundamental culture that we have within our organisation at Health Innovation Network. And I think any of my colleagues on the call would attest to that. But that's something that's done with really clear leadership at every single level of our organisation, all the way from our chief executive down to the newest employee joining our organisation. It's a fundamental part of who we are. But larger businesses should also think about how they can adopt some of those best practices to support those well-being, that employees' well-being, and making sure that we're thinking about how do we set plans and targets and monitor the progress that we're making, but also make it so that they're a really accessible organisation to work for, so that people who may struggle to go into the workplace actually find opportunities within our local regions, that they're not having to move away, so that they can continue to live and work where they grew up. So the last slide from me is that we've got one really clear thing from this white paper, and that is that there is not a single silver bullet that will fix the levelling up of our region. It is a multifaceted approach that is bigger than health, it's bigger than economy, it's bigger than education. It's something that all needs to be done hand in hand. We know that working at that place-based level, really understanding our communities, is absolutely key to ensuring that the right services are there and ensuring that our anchor institutions within our region support that. But we also know that the new government is very aware of this, and as they are building new budgets and new policies, fundamentally getting more people back into work, supported and healthy, is one of their key priorities. And it's something that we as a Health Innovation Network will continue to work with our partners at NHS Confederation and Yorkshire Universities to really bang that drum on making sure that we have that growth and that health within our region. That's everything from me. So I will let Molly pass over to the next person.
Thank you so much, Amy. That was so helpful and really sort of brought it down in terms of understanding how the two are linked. And thank you so much for sharing sort of your personal sort of take on that, because I know it's really important. So thank you so much. Hard to follow that, not going to lie. So we'll swiftly move on to opening up the floor to everybody. So I have done the breakout rooms in the background, and this is the first time I've done it. So that's my disclaimer there. If this all goes horribly wrong, we'll just come straight back to the main room and have a chatter. So essentially, there's going to be about 5-6 people in each room, and what we want you to do, or what I want you to do, I'm not going to the royal we. It's my fault that I'm asking you to do this. So what we'd like you to do is just really try to create that organic conversation between you all, for you all to introduce each other. You may know some people in your room, you may not, but the idea is that we have that natural conversation, just to see what we're up to. What have we been involved with in this space that could spark the interest potentially of someone else. It's incredibly difficult, or increasingly difficult, in the virtual world for this natural, organic sort of conversation to happen. So on that note, let's see if it works. But all I would like you to do really is just a very brief introduction of yourself and your role, why health inequalities and innovation is important to you, and have you been involved in any work related to this agenda? So if you have, what has that looked like? So no pressure at all. Just introduce who you are and what you do, and I'm hoping the conversation will flow. Anybody experiencing any technical difficulties, just let me know. There has been one person, Ben. I've not been able to assign you to the room. I don't know why that is. So if you sort of want to go get a cuppa for 15 minutes, or look at those questions and then send them over to me in a chat or by email, and I can bring you into the conversation at the end. I don't know why that's happened. I will try and work on it in the background, but if that sounds okay with you, then we'll get everybody into the rooms. So sure. Everybody cross your fingers and toes and pray for a miracle. So let's see how this goes. Open it. You will all be coming back in 15 minutes, and that should happen automatically. Happy chatting, everybody. Okay, so we still have Ben here, and we still have Mal. So Mal, let me see if I can get you in. Hi, Ben. Are you okay?
Yeah, I'm all right. I joined a bit late because I had some trouble with Teams. I got some weird error message about 3 devices already being registered. So that might be something to do with why.
That might be right. For some reason, Ben, it's not. You're sort of completely greyed out, and it's not letting me add you to any. So I'm really sorry about that. We can. That's there's right. 3 of us in here. There's other people. The rooms are in other things, so we can keep it to us 3 and just have a 10-15 minute chat. Feel free to go get a cuppa if you want.
Oh, yeah, we can do that. Oh, that sounds good.
Sorry, Kim, I'm just going to really rudely interrupt really quickly. Did you say that I need to go into a room? Is there a facilitator in the room?
So I've shortened the rooms more because I've done 6. So there's now 4. So you are similar to Ben in that I couldn't assign you to a room.
Okay.
When it gave me that option. I think my camera might put up. That's in room 2. That's fine. Let me see if I can put you into room 3. That's where you were meant to be going, Mal, in room 3.
Happy to stay on here and we can have a chat between us 3.
That'd be great. There are people in the other room, so
yeah, no, that's fine. I just wanted to double check that I wasn't.
Yeah, you've been room 3 from the start, but it's not letting me put you in.
Must that want to go?
Me, Mal. Did you guys meet at the Hive? Because Ben was at the Hive event. That's how.
Yeah, we did. We were on the same table in the breakout.
On the innovation one, it was. Oh yes, I remember you were sat next to my.
I've lost a bit of hair since then, so you might not recognise me.
Yeah, I was thinking, and then to be honest, I think everyone looks completely different virtual and and in person as well. But yeah, I think you've also been in my inbox as well. You were.
That's right. Yeah, I think you're arranging a call with us and Amy for later this month, aren't you?
Yeah. I think I just need to double check. I can't remember exactly where we are with that. I don't know if I've had a response or.
I just emailed you earlier today, so you probably haven't had a chance to see it.
Does that sound? 29. Yeah. Perfect. Yeah, I do remember. I will respond to you after this.
No worries, no rush.
This webinar. Sorry, Ben.
I've got I've got her doing all sorts of bits and bobs for me, so she's probably not got loads of time for email. That's probably my fault.
No.
Yeah, I know I missed the last 3 webinars, so I mean, being in those breakout groups, I would have just been playing catch up, to be honest. So it's not a problem that you can't add me, but I'm interested to watch the recordings when they're available.
Yeah, I can share the recordings with you, Ben, and I think I sort of provided a summary-ish I can't remember if I did or didn't. But essentially, if it's useful, I could use sort of the next 10 minutes or so just to sort of talk you through what the other webinars went through to a degree.
Yeah.
And
that'd be
so when
interesting.
the sessions have ended, I'm working with our comms teams to share it'll be put up on our YouTube channel, and then I'll share the link with all the attendees, so you should get that. And alongside it, I'm doing sort of a resource document which sort of covers the webinars and the discussions that's been had in the webinar sessions, but sort of as a useful guide that people can dip in and out of, which is hopefully helpful. So this was sort of born out of the idea of trying to make health inequalities and innovation a little bit more accessible. So having a sort of passion about it is one thing, and it's already difficult to try and get your head around health inequalities stuff and the vast amount of material that's available and information that's available. And sort of rightly so, it's a very complex issue, and you know, for very good reasons. But I think because of that, a lot of people are almost put off in terms of not really understanding or knowing what their place is within this. So I covered a lot of that when I presented at the Hive. But what we were trying to achieve is to make it as accessible as possible, but also something useful that if people came and attended and you know went through each one, that they would be able to have an idea about what they could do within their role. So we've covered a real good range of topics, and the idea is that we don't want people necessarily to, we don't want them to leave the webinars as experts in anything that we're talking about. The opposite, really. We sort of want, all we want to do is ignite the sort of the fire in their bellies to want to do something different in their places of work and have an understanding enough to give them the confidence to do something moving forward. So the first one covered sort of the essentials, and that was very much sort of high level. What is innovation? What is research? What is health inequalities? How are the three linked together? And how, trying to cover sort of the fact that it's important that you consider all three. You can't work in silos if you're wanting to try and make real change in any of them. And then how you would go about that through the golden sort of thread throughout the whole webinar series is we try to provide a platform for some of the amazing work that's happening in our area. So we've asked speakers to come along, and Catherine will do this later on in the session, to sort of showcase some of the amazing stuff that's happening. And again, in doing that, we're hoping that the attendees recognise themselves in the speakers, and they either think, oh, that sounds like something similar to what's happening in my area, or that's something that I could give a go, or something similar, and just start that conversation. And we are limited in what we are able to sort of do in the time that we've had. So we've sort of got 1 hour every week for 4 weeks, and that's been done on purpose because we didn't think people would be able to commit more time than that. And it's a fine balance because you always get people. Hi, Sean. I don't know if you've joined from another room or if you've joined this one, but you're more than welcome to stay here with us. We're just talking about the webinar series.
I didn't have I was in room 2, I think, but I could see Fran, but see and hear her, but she couldn't see or hear the other couple of us in there. I don't know what was happening.
Oh no. Let's have a look. See if Fran's put some. I've got another group set up for us on the. I'm just going to see if everybody's okay. Oh, Fran is typing something.
And I don't know if my internet dropped, but I got kicked out.
Don't worry at all. You can stay and join the conversation with us.
Whichever. I'm happy to do anything.
Fran's. I've got another group set up just so I can keep an eye on everybody in that, and everybody's okay. So everybody's good in Amy's. And if Fran's having difficulties, then we can bring everybody in. Yeah, they left and tried to rejoin. Okay, let's see how that plays out then. Fingers crossed everybody can join back with us.
My Teams has been playing up all morning.
Don't worry at all. That's the joy of Teams when you try and do it this way. But we're very happy to have you in this group, so don't worry at all.
Fine.
So just going through some of the webinar series for Ben's benefit, really, because Ben hasn't been able to join us for the first 3. So just going through some of the stuff that we've covered. But seeing as you're here, and I'm really keen to hear from you, Sean. So I'm so sorry if you've done this in the other room, but for all of our benefits, would you like to introduce yourself and just let us know sort of the work that
never got a chance in the other room. Yeah, Sean, I think like yourself, Kim, on the Health Equity Fellowship at the moment as well.
Ah, lovely to meet you. That's great.
Which is why I picked up the invitation to this. But my main I do a couple of part-time jobs, but my main role is working as a community project coordinator across three community partnerships in the Bradford area, which is working partnership between primary, secondary, care, VCSE, local authority, community centres, community partners, and we sort of working to reduce health inequalities on a hyper-local level, really, just on an area of each community. We sort of work in areas of about 60,000 to 80,000 population, and we manage the core 20+5 in sort of across each of our areas as well, and then we also have sort of funding to fund very small grassroots organisations, which I sort of manage the grant process and liaise with each of the small project providers, provide grants, maybe £500, couple of thousand, for projects tackling health inequalities on a really small, innovative level. Some are traditional projects, some are quite innovative. We try and support a full range, but working mostly in areas of deprivation.
Wow, that must be really rewarding. I can imagine incredibly difficult, but very rewarding, especially sort of at that, really sort of concentrated local area.
Yeah, I found the first presentation now really interesting, because my fellowship project is around my own experience of not having been able to work for a while due to ill health, and then being able to get back into work slowly. I didn't work for 8 years. 2 years ago, started part-time, and now back full-time. Across two or three different roles, but all interconnected. And my project is around trying to support people with long-term conditions into employment, trying to work with employers to support the people with conditions back into employment. So I've been doing a load of work around that over the last few months. So it's very relevant and interesting.
Oh, I'm really glad, but a huge congrats to you, John. That's a massive undertaking, and I couldn't think of anyone best placed to, help others get back into the workplace from somebody who's been through that themselves and understands sort of, really, really hard sort of work and undertaking that is. So huge congrats.
Okay, yeah. So it's very, interesting.
Yeah, I can imagine.
As you deal with different organisations and individuals, and the projects we support and help, from small ones up to some of the bigger ones too, the core 20 funding. It's a range across local communities, the different, and it's amazing. You can go 2 or 3 miles up the road and the needs are very, very different.
The
community, trying to work with the community rather than for the community, trying to find out what the community need so we can support that.
Yeah, absolutely.
There's just never enough funding, of course.
No, never is enough funding, unfortunately, and that's part of the battle. I'd be really interested to understand more about some of the work that you're involved with, Sean. We have a health inequalities portfolio, specifically a Health Innovation Yorkshire Humber, and it'd be really good to link up. So if you wouldn't mind sending across some details, I can put us in some time when we can talk about it in a bit more depth.
I'll put my email in the chat.
Brilliant, that would be great. Bob, conscious that you've had your hand up very patiently. It's very good. Teams
can't access the chat. It will. I'll drop you an email, Kim.
Yeah, that'd be great, John. Thank you very much. Do you want to come in, Bob? Obviously, I know you've had technical difficulties in Fran's room, but it's lovely to have you with us in this room. Do you want to introduce yourself? And
that's what I was going to say. Is it worth going back to Fran, or the breakout rooms closing soon?
They'll be closing soon, Bob, and Sean's had the same difficulty, so you're more than welcome to stay with us in this room. And we
we were both in the same room with Fran, and it just.
I met Fran a few years ago at Thrive by Design. Some work we were doing on patient access to online information. I advised them on what I'd learned that excluded so many patients. And I'm still doing that, but my reach is a bit restricted because of no funding and limited access. So that's really what I'm wondering we can do with the Innovation Hub.
Okay, so you want to find out a bit more information about funding?
Well, funding and being able to work with others and make what I'm trying to do and spread it over a wider area. At the moment, I'm only looking at Leeds because it's geographically easier.
Yeah.
I can take that one if
But
you'd like.
it's an ongoing conversation.
Yeah, that sounds amazing, Bob. So more than happy to have a chat. I work as part of the West Yorkshire Innovation Hub team.
Just quickly to give you an idea, 50 to 70% of patients cannot read health information online.
Yeah,
That's how bad it is.
It's huge numbers, and that's exactly why we're all here today, isn't it? To try and reduce those numbers and make sure that everyone has access to fair healthcare. Who do you? Is it? Sorry, go on, Bob. Sorry.
I'd like to talk with other people and see what they know.
Yeah. So, is it that you work for yourself? Is it? Sorry, I may have missed that. Or do you work within a trust? Or
I am. No, I am a member of trusts and some local non-profits. And patients and some of patient experience teams sort of understand what I'm trying to do, but don't understand how to help. So I keep reaching blockages, and I don't know what other people's experience of tech departments is. They tend to regard anybody outside their own sphere as not able to understand what they do. So you can't talk with them and talk them around to making something accessible. Through the work I've done with the neurodiverse review, I have met quite a few actual people from actual patient clinical groups who need support, and they're almost tearing their hair out trying to get a website with information on that they can exchange with patients, and tech departments don't understand what their needs are. So that's another part of the problem.
Yeah, there's lots of different kind of obstacles and challenges that we need to overcome. I have just popped my email in the chat for you, Bob. If you want to drop me an email across, we can look at getting something set up and have a deeper and more wider chat around there.
Yeah, absolutely. We have actually exchanged emails already. So, but yes, I will.
Perfect, not a problem. Yeah, that sounds great, and we can get something in the diary then.
Thanks, Mal. Thanks very much. It's been really interesting, and apologies for any technical difficulties that we had. I did foresee that happening, not going to lie, it always happens, but I hope that it worked out okay. We sort of adopted some of Fran's room into our main sort of room and had a great conversation. So essentially we spoke with Sean and Bob, who sort of introduced the work that they're doing, and a lot of local level line work, which is really interesting. So we've been able to swap some contact details that we can take the conversation further online and explore options for sort of scale and funding. Oh yeah, that's good. Don't worry, Fran. We had them chatting, so don't you worry at all. Does anybody want to give an overview about conversation in their rooms? Because of the rooms all changed now, I've lost sort of all orders. But there was who was in room 2?
Oh, I didn't look at the room name.
Amy, you go.
Do you want me to go? I can do that.
Yeah,
I can do that bit. I didn't look at the room. Sorry, Kim. So we had lovely people in our room. So we had Natasha and Holly and Claire. I'm really hoping, Natasha, I got your name right because it just drew a blank. So I'm really hoping I didn't get that wrong. So Natasha works at 100% Digital Leeds and was talking about the work that they do. And obviously we know them really well in the Innovation Hub. We also got joined by her beautiful dog who was trying to steal some cheese off her plate, which is always a highlight. Holly is a doctor at Mid Yorks and actually saw the Red Bag scheme in person recently and found these really helpful in understanding kind of where that kind of came from and how health inequality is baked in, but also spoke about, you know, how homeless people are utilising hospitals more as a safe place. Claire, who's part of Health Innovation Yorkshire and Humber, was talking about how we were developing an internal toolkit on health inequalities to ensure our staff culture ensures that everyone is aware and understands health inequalities and the things that we do and how we bake those into our projects. But was also talking about some of the population health work going on in South Yorkshire at the moment and how we're trying to collate a library from there. And I quickly discussed about the ambulance conveyance and deprivation project that we did in Wakefield Place recently, and how we saw, we went in with some assumptions and they were completely not the right assumptions. And actually how we saw that people living in the most deprived areas, their life expectancy stopped at 75 and there were no call outs after that, in comparison to our more affluent areas where our highest call outs were 75 plus. So you could actually see the life expectancy really clearly in the data as well, and that was quite impactful as well in terms of how we think about our services going forward. So that was our happy little group, and we had lots of dogs and it was wonderful.
Well, that sounds absolutely amazing. What a lovely way to spend a chat. That sounds great. I'm just conscious of time. So what I would like to do, if anybody would is keen to share their contact details and link with other people, you can either pop your details within the chat, or if you've heard about anything within your teams that you think, oh, that's, sparks some interest, or you want to hear more info about, then please drop us a line and we'll act as the matchmakers, if you like. So we'll put people into contact with one another. So reach out to us if you're not comfortable enough in popping the emails into the chat, and then we can link you all up. I'm going to move on to, I'm just going to say, I hope that was useful. It didn't go as planned and we have less people with us today, but I hope that was something that we I really want people to be able to interact and not just sort of watch behind the screen. So we're going to move on to Fran, who's going to talk to us for a few minutes about the Hive and just some of the amazing work that's happening there, and hopefully that should answer some of the questions that you guys might have in terms of scalability, moving forward with ideas, and where you would need to go with them. So Fran, the floor is yours.
Thank you, Kim. Hi, everyone. I'm Fran, and I work within the West Yorkshire Innovation Hub team at the Health Innovation Yorkshire Number. I'm in the team with Amy and Molly, and also I work with Kim. And I'm a program manager, and I am leading on the Hive network. Can I get the next slide, Mols, please? So let me explain a little bit about the Hive, what it is. So it's basically a collaboration between the West Yorkshire Integrated Care Board, the West Yorkshire Innovation Hub, which is my team, and the NIHR Yorkshire Number Applied Research collaboration. Basically, what we wanted to do with this network is to create a community, and it's to create an environment where people can collaborate together and have got an interest in innovation and research and innovation. The Hive network the format of it is it's 2 events every year. We just had the launch on the 4th of October. And it's open to all staff within the West Yorkshire interested in innovation and research and innovation. So no matter your background, community care, social care, voluntary sector, health sector, it's kind of like the purpose is to bring people together and sort of like co-create and understand what are the topic and the challenges that people are interested in sharing and tackling. And one of the main goal of the Hive is to have a very inclusive approach to make sure that every voice is heard. Next slide, please, Molly. So as I mentioned a little bit previously, the purpose of the Hive is to learning about our system-wide plans for research and innovation. It's also to provide insights into the how important it is to have evidence-based decision-making in innovation. again, we want to bring everyone together, so the promoting community empowerment and collaboration. And we also want to embed the West Yorkshire research and innovation commitments into the West Yorkshire system. So understand what they are and how they fit into what we do. And again, it's all about collaboration and helping, and people sort of like informing and helping shaping and designing the future events, following, you know, what people are interested in as well. Next slides, please. Again, it's open for everyone with an interest in innovation and research and innovation. And we want to, the aim is bringing together different perspectives and to collaboratively shape the future of our research and innovation network and environment. When I say everyone is involved, I also refer to the wider system, the industry, academia, patient voices group, and healthcare, social care, community care. So really sort of like we want to bring everyone together. And again, we want to drive the reduction of health inequality through research and innovation. So this is at our very core of what we're trying to do. Conscious of the time, and appreciate that I've probably talked for too long already. I'm happy if any of you has got any questions, I can get questions, but otherwise in the next slide there is my email address. So if you would like to be included in those events or communication for those events, please do reach out. And we are planning the next one in April. So yeah, that's about it. If Molly wants to share, if you want to sort of like share the last slide, Molly, so people can see my email address. I don't know if it's there or not, but otherwise I'm happy to pop it in the chat so people can just copy and paste it. Thank you, everyone.
Thank you so much, Fran. That's really helpful. And I appreciate, as with everybody who's spoken on these webinars, it's not long enough at all. Liz, I've just seen that you have to pop off. No problem at all. I'll be able to share all the recordings once we've wrapped up today. So that's absolutely fine. Thank you for being with us today. So before we have about sort of 10 minutes left. We wanted to end the series on a huge bang, and the next speaker that we have, which is Catherine, really doesn't need no introduction because she's absolutely wonderful. But we have Catherine to talk to us today about some of the work that she's been involved with. And I hope that throughout the series, what we've tried to do is provide a platform for people to come and showcase the amazing work that they've been involved with, so that ignites the sort of the fire in everybody's bellies to want to go and change something too. So I don't want to take any more time up of Catherine's. Catherine, the floor is all yours. So thank you so much for joining us today. And over to you.
Thank you, Kim. Firstly, I would like to say good afternoon, everyone. My name is Catherine Harbury. I am employed by the South West Yorkshire Trust as a peer support worker, and also I've been a peer leader too. I love it. I would like to say thank you for letting me come today to share with you all my presentation. Next slide, please. Okay, so living with Down syndrome, but this hasn't something leading a normal life for myself. Although there are things I can't do, but it has taken me time to learn things. But with the help of my family, I have managed to learn things for myself too. I can read and write. I went to a mainstream school called Greenleys, then went on to Emerson Art and Community College, where I left with excellent grades and qualifications in foundation courses. I am not great with managing money. I get frustrated and a bit confused. However, I know I can ask for help from my family. I like to please my work colleagues and sometimes say yes to things, but I am not fully understood, so I need to explain it to me. Next slide, please. So these are my photos. My photos mean so much to me. They really do. I will share them with all of my heart. I love all of my family, especially my amazing sister and my brother-in-law, as they mean so much to me. Next slide, please. Okay, so why I became a peer leader. I became a peer leader as I want to be more inspirational and to make sure that my voice gets heard, which is really important for people to make a difference. And that's what peer leader is to me. I wanted to improve my confidence, independence, and working together with people, not just people with learning disabilities, but other people too. It is important to me that people's voices are heard and to encourage others to speak up for themselves too. Next slide, please. Okay, so what I have learned during the peer leadership program, a learning disability is a long-term health condition. I fit into a personalised care program. People with a learning disability die about 20 years younger than the general population. I help other people with a learning disability be able to speak up for themselves at health appointments. I make it sure that readable adjustments and easy-read documents are available to use. I work with a complex needs team or any other appropriate person or services to make a difference. Working together to learn from each other and help each other to achieve the best outcomes. Next slide, please. This is what I have learned during the peer leadership program. During the peer leadership development program, I have learned to use my own knowledge, my lived experience I have got, and my communication skills. Listening to other people's opinions and learning how to respect each other and to be open-minded. Next slide, please. Thank you. This is building up my confidence up. I have a lot to give, especially now I have developed my skills and my confidence, enabling me to build up my independence and give help, make changes by saying my personal story. I have been through many things in my life. However, I do like to say happy memories that I have got. My lived experience has helped me to achieve everything what I have. One of them is meeting the judges of Edinburgh. It was a brilliant opportunity for me. It felt so amazing to be going down to London and doing a speech in front of several Essex. That was quite personal to me, and it hit the newspapers and on social media too. The Daily Mail included a photo of me taking hands with her. I loved it, and meeting other people too. It was a great day. Meeting the judges of Edinburgh was a wonderful once-in-a-lifetime opportunity for me. I was so proud of myself. I was talking about my work and telling everyone but it is essential to get healthcare right for people with a learning disability. It was important for me to talk for the people who may not be heard. It was one of the biggest achievements of my life. I have also been involved in a photo shoot. Excuse me. At Pontefract Hospital, run by Mencap, where I was being a patient for the day. I really enjoyed it. It was fun and amazing to be a part of it too. And it will help others to see our services are accessible. Next slide, please. Yeah. So after the peer leadership, I now attend and co-chair our working together peer leader meetings. I have found this very useful and interesting. And made me feel confident to set ideas. I am a joint chairperson of the Patient Experience Group with Debbie Gittins, my colleague, who is on call today. So thank you. In Wakefield, it is a sub-group of thank you for people with a learning disability, which helps people's voices to be heard. Next slide, please. So this is my role as a quality checker in GB practices. GB practices do annual health checks for people who have a learning disability. This is to pick up on health issues that may have been missed, or when the person is unable to recognise a change. I go to GB practices to check that the services they offer are accessible for people with a learning disability. We also ask the practice manager questions about the surgery using the Attendable app. Thank you. So I came into my current post as a peer support worker at the Horizon Centre at Hillhead in April 2023, and I couldn't be a lot prouder of myself. By getting a paid job, I've been employed by the South West Yorkshire Trust as a peer support worker. I have met lots of different people who come in and out of the Horizon Centre, and I do feel a part of a team. They are very friendly towards me. I have been in my role now for 1 year and 6 months. I feel I have achieved many things. My job includes preparing documents in an easy-to-read format for our service users. I get supported with planning activities such as art and crafts, which I really enjoy doing. I'm making sure I can speak up and making sure service users are also getting their voices heard. And I do various things to develop my confidence by communicating with our service users. Next slide, please. As mentioned, people with a learning disability die much younger than other people. We need to be initiative and do things differently to make this change. Will you help me make this change? Thank you. Debbie, would you like to ask any? Would you like to come in and if there's any questions you would like to ask as well? Debbie, you're mute.
Sorry. Yeah, you were amazing, as we knew you would be, Kath.
Thank you.
But you do work tirelessly, and you've also, since doing this presentation, been nominated and won the Unsung Heroes Award. So we can tell people that as well, can't we? Because you do work for Swift as paid. You do so much voluntary with the PEG groups and Stronger Together groups. You are inspirational. So thank you.
Thank you.
I could not agree more. Thank you all so much. I've got literally nothing to add to that, and I don't want to add anything else to that. So Molly, if you could move on to the next slide. I think that's a really, really, really poignant way to end the series, and really just, you know, is a real stark reminder as to why this is so important for everybody and why we all need to play our part, however small or big or everywhere in between that part is. So we have a QR code for you to scan. As normal, so you'll be used to this by now, but this is a little bit more. So if you remember on the first webinar series, we asked for you to just gauge your knowledge on baseline on some of the topics that we've covered. It's really important if you're able to do that again for us so that we can really try and measure if we've been able to have an impact in that and what we need to do to make this better. This is the first one that we've done. We're hoping to do many more over the sort of coming months and years, but we really do need your input to make that, you know, something meaningful, and this is for you guys, not for us. So any comments or feedback that you can give, however critical or friendly and anything else in between, is very much appreciated. So if you're able to do that, we'd be very grateful. And the last thing really to say is thank you so much to everybody for coming, and thank you so much to everybody who's joined us throughout the series, and for all the speakers that have joined us and shared their amazing, wonderful stories. Catherine, I could not have hoped to have ended it any better, so thank you so much for sharing that with us today. So grateful for your time. I know how busy you are, so I feel very, very lucky that we've been able to steal you for an hour. Thank you so much. And on that note, everybody, have a wonderful end of the week and a wonderful weekend, and watch this space. Hopefully you'll hear more from us soon. Thank you so much, everybody. Take care.
Thank you. Bye-bye.